So the anterior cruciate ligament is one of the most commonly injured ligaments in your knees. It is actually the back on the inside of the knee right here. So if you look at the knee, I'll probably get a better photo up here. If you remove this back ligament here, it's this one right in the center of that knee. And the way the knee is designed, or the anterior cruciate ligament is designed, is it inserts at the front of the knee and goes all the way across to the back of the knee right here. So it crosses from the front to the back like that, okay? The main job of the anterior cruciate ligament, or the ACL, is to prevent your knee from gliding forward, okay? Just like that. So if you have an ACL injury or you've had ACL surgery, the most important movement to avoid is open chain leg hanging or open chain leg extension. The reason we do this is the weight of your leg is usually about 7 to 10 kilos. So if you dangle your leg in the air, all this pressure is going to force that ligament to stretch, and if you've had a fresh surgery, I've seen people where it's snapped before, so you don't want to do that. Prevent hanging or dangling your leg in the air as much as possible. So there are a few ways to do that while you transfer. Most commonly, when I see people get on and off beds, they usually dangle their leg in the air. This is how you avoid that. So the most important thing about getting on and off a bed is to make sure that the bottom of your leg is supported. So the way we do that is you can either use your hand or you can use your other leg. As you transfer on and off the bed, you want to tuck or lift from under the calf, lifting up, taking down, and placing it on the floor before you jump up. You can also do this by looping your other leg underneath, okay, sliding it underneath, lifting up, and bringing it down, making sure it's firmly planted on the floor before you jump up.